This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
I want you to know that Dr. Molly and I are appropriately attired today. Sweater, jacket, coat.
Yeah,
you know,
true.
we're gonna keep you warm, but we're gonna try to stay warm ourselves here on the show.
Yeah, John, you're right. I got to go get a haircut today, and I'm sort of dreading. I usually walk there, but maybe I shouldn't.
Right, it's going to be the jitney for you today, right?
I think so.
Okay, it's Health Watch every Sunday, 8 till 9. Talk Radio 1210 WPHT, as the man said. And what do we talk about here on Health Watch? We talk about a variety of issues, all related to your health, of course, with the one and only Dr. Molly Fantasia, as you heard the man say, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. And if you have a question or you have a medical challenge you want to run by Dr. Molly at any time during the course of the show, 855-839-1210 is the number, 855-839-1210. We'll talk about the who, what, when, where, why, and how of Innovative Medical and how they could potentially help you and anyone you know as far as improving your overall quality of life. And again, that number, 855-839-1210. We'll talk about Dr. Molly and how Innovative Medical is different from what you would come to expect. I mean, it is different and unique.
Yes, actually.
I mean, it's all of those things.
John, you know, I had a great, interesting consult this week. Since we're talking about how unique we are, I had a wonderful physician who is a member of a group of physicians in an organization. You know, like people join up with the hospital systems, that kind of thing. This is a small independent system, not so small anymore in New Jersey. She came in and she said, "Hey, Dr. Molly, I'm really glad I got to you." I said, "Why?" She said, "Well, you know, I'm a pediatrician," and she said, "I was on call all last weekend and I needed hydration. So I went to this hydration, quote unquote, spa and said, this is what I need. And they threw me in the chair. And then they told me they were out of vitamin C." And I said, "Oh." And she said, "Just then I remembered someone talking about you, and I called you for this week." And she said, "I am so happy with how you proceeded in my visit, my free consult, that I just told 3 or 4 other physicians who are on the faculty, we need to learn more about this." I said, "Well, do you want to open this up? You know, do you want to open up a place?" She said, No, we need to learn about it so we can tell our patients where to go."
How about that?
That's a wonderful thing. So, John, I have to thank you for some of that, I think, getting the word out.
Well, we try.
We try. So let's talk about why we are different.
Right.
Well, we're different because we are actually working out of a primary care facility. So all of our cooperative physicians can do what? They can do anything any primary care physician does. So if you need a blood test, if you need a prescription, if you need some radiology, we can get it all done for you. But our philosophy is what really separates us from everyone else, in that we want to use the least amount of the pharmaceutical intervention in your care to effectuate the change, but minimize the side effects.
And that's really the bottom line.
Right. And how do we do it? You know how we do it.
I know how you do it, but it's interesting because, once again, the weekends, I guess they buy, the pharmaceutical companies buy ads on weekends heavily.
Oh, yes. Especially holiday week.
Exactly. And again, watching yesterday, and it's like the disclaimers are always longer than the commercial.
Absolutely.
So you say to yourself, all right, so that helps with that condition, but then it doesn't help if it does this or this or this or this or this. So it's like, okay, so where do you draw the line, and how do you figure this out?
Well, I think you figure it out that if you need a pharmaceutical, you know what Dr. Molly says, you got to take it.
Right.
You need antibiotic, you take it all the way through so that you utilize the antibiotic the way it's prescribed. But if we can get away with helping you diminish some of the dosing for your chronic conditions, that's what we like to do by really implementing natural substances.
And when you're talking about natural substances, you're talking about not just vitamin C. You're
No.
talking about other things,
You
right?
bet. You bet. We may be talking about vitamins, minerals, amino acids.
And all of those could be in your hydration bag. Right,
Exactly.
right.
Exactly.
And we should mention that hydration is how you deliver
That's right.
the nutraceuticals.
Peptides are something else. So, I mean, we can deliver a myriad of particular natural substances to help a patient with their conditions, or just to keep them well hydrated and make you feel good.
I'm sure you've heard this many times, especially in a consult, where people say to you, well, Dr. Molly, I take this pill, I take that pill, and, I guess I could take another pill. Does this work? Does this help? And how does this fit in?
Well, I think
because I know people do have that.
Of course,
question.
of course. Well, first of all, we're going into our 26th year, as my lovely Linda tries to correct me all the time. So, yeah, we're going into our 26th year. So, believe me, we've had a lot of data in 26 years to show that this works. But I still go back to one thing, John. How does the patient feel? What is the qualitative data? Are you coming into me and you're dragging, or you're coming into me where you're having maybe some angina pains, this kind of thing? Has some of that has some of that been corrected, and you're having less of it? I think blood pressure. You're coming in for your blood pressure, and have we been able to reduce your blood pressure meds? Is that proof enough?
Yes, absolutely.
I mean, come on in, talk to some of the patients. We'll tell you.
And I have to tell you that, and I've said this before, and again this week, a little bit of feeling like maybe a cold is trying to come on. But I had 2 drips this week.
Yeah,
and
you're
then,
back in the pink
Back
now.
in the pink, and it was like that feeling was gone very quickly.
And John, we have to say, you come in twice a week because I'm dealing with several comorbidities for you. I have lots of people that only have one problem, and eventually they go down to a little lesser often coming into the office. But it all depends on the patient and what they're coming to us for.
What works best? What condition that you treat with patients, have you found that one thing, one condition it works better, or is it just a variety of things?
I think what I'd like to say is, I think that what we have done is we have promoted overall health for patients, whether they're going through some serious conditions or some conditions that are chronic conditions like diabetes, and maybe some blood dyscrasias like anemia. And also with patients who are doing very, very serious conditions that may have just creeped up on them, and they have some other comorbidity. So, it really depends.
And I know you do a lot with cancer and cancer support.
Yes, of course, and autoimmune diseases, post-Lyme. So it really depends on the patient. One thing I would say, that the delivering of the hydration natural substances is a better way to go than going to the health food store.
Side effects for natural substances?
Sure there are. Of course, you know that. And many times when you go to the health food store, they don't necessarily have a black box warning on it like they do for many drugs. But there are some things you shouldn't mix together. And that's why you should go to a place like ours, where we have an understanding of what kinds of things can work synergistically and what kinds of things shouldn't be mixed together.
I know I go into the health food store and I only get what you or your nurse Barbara tells me to get.
Yeah, Barbara's great at this.
I don't ask for, well, what do you have for this or for that? Because then that opens it up to,
But one thing I will say, there are some people who own health food stores. Like I have a gentleman who's my patient, who's so bright, he understands what he has, and he can help you. He can guide you. But lots of times, not so.
All right, we're coming up on our first break of the morning. Our show is called Health Watch. You'll find us here every Sunday, 8 till 9. That's our live version here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. You have a question for Dr. Molly, you have a medical challenge you want to run by her, or you want to find out more about what Dr. Molly does and how it can help you? Real simple. Pick up the phone and call 855-839-1210, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Back here on Health Watch, don't forget, as always, operators standing by at Innovative Medical Associates. And they are there during the course of the show and well after we leave you at 9 o'clock. So if you want to call in and make an appointment to sit down with Dr. Molly, that's probably the best way you can get the information you need. But you call this number, 856-489-0505, 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And again, that number, 856-489-0505. And also, you can check out on the web a lot of information there, innovativemedicalassociates.com, innovativemedicalassociates.com. Somebody asked me a couple weeks ago, when I was sitting getting my drip, they said, well, how can we listen to previous shows? Very simple. You go on the website, innovativemedicalassociates.com, and there's a button you click. It says radio shows. You click, and all of the shows we've done in the past, probably like more than 50 shows, they're all right there. You could check them out, all right? 855-839-1210 is the number. Here in the studio, it's Health Watch, Sundays 8 till 9. Talk Radio 1210 WPHT. Let's go to the phones. Frank is in the Northeast. Frank, good morning. You're on Health Watch with Dr. Molly.
Hi, Frank.
Good morning, Dr. Molly. Good morning, John.
It's my favorite, Frank. How are you, Frank?
I feel sorry for you already.
No.
I have a thank you and a question, Dr. Molly. The thank you is Christmas time. I was kind of stumped to get my mother and my aunt. I said, wait a minute, Dr. Molly skincare products.
Oh, you are so funny. Thank you, Frank.
No, I'm being serious. I can't drive anywhere, so I got a friend, and we went online and got a couple of products for my mother and for my aunt, and they both love them, so thank you very much.
God bless your mom, too. She's a wonderful woman. I don't know your aunt, but I know that your mom came with you for a visit with us, and I really think she's a great and special woman. All right, Frank, what can we do?
When I saw you, that was the best I ever felt, too. The question is, I had my hair analyzed. I got the results back on Thursday.
Yeah. Great.
It showed high sensitivity, moderate, or low. And pretty much everything came back high sensitivity. It also showed that I forget, all the good bacteria in my stomach is real low. But analyzing your hair, is that accurate?
Well, now that really is a loaded question, Frank, because, listen, they use hair analysis in a lot of forensic types of things, as you know. It really depends on the laboratory, right? As well, it depends on the laboratory no matter what kind of analysis you're doing. Now, I know that there are quite a few laboratories that are usually connected with institutions of higher learning that are extremely accurate. Also, I know some out of New York that are extremely accurate because they're used in the forensic field. It really depends, Frank, but the hair does accumulate a lot of substances, so it can be a good biomarker for some things. I hope that answers your question.
Well, Dr. Molly...
And I think, again... Okay, yes. Go ahead, Frank.
To me...
Frank?
I'm pretty much stumped what's going on with me. And what it showed was pretty much something I believe, but the medical doctors, they don't test for it, and they kept saying, no, that's not possible. It showed pretty much I can eat what I want to. It's all healthy stuff I can eat. I can eat any kind of meat except for turkey, shrimp, and prawn. I can't drink no milk except for almond milk. And no grains except for oatmeal.
So what you did was a nutritional evaluation on your hair follicle, right? Is that what you're trying to tell me? Is that fundamentally what they did?
It checked for sensitivity for food, liquids, environmental things, and heavy metals.
Okay. Well, I would tell you that I think that probably the heavy metals and the environmental are extremely accurate, and aspect, I would love to see the lab. Why don't you call and ask for Barbara and give us the name of the lab, and then I'll look it up and tell you what I think. How about that? I'll give you a biochemist seal of approval. All right,
Thank you very
Frank?
much.
Can't do
Thank
any
you.
better than that, Frank, okay?
Thank you.
Thanks for
God
the call,
bless
Frank.
you.
Appreciate
Bye-bye.
it. Christine is in Plymouth Meeting. Christine, good morning. You're on Health Watch with Dr. Molly.
Hi, Christine.
Hi, good morning, doctor. I'm calling for my elderly mother who has no other health issues other than
God
the
bless
fact that other than the fact that her knee is bone on bone, and the doctors, she's been to several orthopedic doctors, and they say there's nothing they could do. They've tried all kinds of injections, the chicken thing or whatever, and nothing is helping her, preventing her from walking. And I had heard of someone who has an implant placed in their hip, and they would just push a button or somehow, and it would send down medication to the leg to alleviate the pain. Are you familiar with that?
Well, I find that interesting. What they have, they have what they put in in the pain medication under the skin, and they have to refill that, right? They have to refill that. They have to go back in. It may not just be what they do is they generally follow the nerves from, like, not just from the hip, but from where the nerves radiate down through the leg. So there is something, but you need to go to a very good pain management physician for that. Now, how old is your mom? Just give me an FYI on that. How old?
She's 95. She's 95.
Okay. Well, you know what? I'm going to tell you something. You're in Plymouth Meeting, though, but I have a very, very good pain management doctor or group that I could send you to, and they may be able to help your mom. And I think, it's an interesting thing, and you know, God bless you for exploring all of that. Okay?
Thank you.
So call the office, and I'll give you the name of the pain management group. They're nice guys.
All right, Christine. Thanks a lot for the call. Appreciate it. 855-839-1210 is our number here, 855-839-1210. I know you wanted to talk about this, and that is where you cut your teeth on many years ago.
Chelation.
Yeah.
Well, actually, John, what I wanted to talk about is something called microvascularization, and chelation plays a part in that. You know, for years I've talked about chelation and the use of it in terms of cardiac nutrition. But right before the holidays, I don't remember what show, we actually talked about endothelial, the transparent lining that lines all the vessels, whether it is the large vessels, which I usually talk about with chelation because I want to extract plaquing, or smaller vessels, including the veins. But I'm talking about even smaller still, and I'm talking about that in reference to things that we do in our clinic. We use something called the Cleveland Clinic Heart Evaluation Test, and that looks for micro challenges to heart patients, and also for other types of conditions that are affected by vascularization, meaning vascular conditions. So things like the lipoproteins that make up things like the LDN, smaller particles. So we actually have developed the chelation that actually works on regenerating the endothelial lining that lines all the vessels. So it not only lines the large vessels, so chelation as we know it when I spoke about it, EDTA chelation, to open those up, we have to look at the inflammation on the smaller vessels like the veins and the capillaries. Look at the capillaries behind your eye. Think about how small they are, but they still have something in there called the micro endothelial lining.
You started your practice, and you said you're now in the 27th year. And I remember, because I was around in the early days, that was really what you did. You cut your teeth on that, on chelation.
That's right.
Has there been improvements? Has there been
differences? In our clinic, there's been improvements.
Right. So the chelation today is different than what it was 26 years ago, right?
It can be much more specific. It's not just the EDTA, and it's not just the cardiac nutrition, but we're able to look at other factors that can contribute to people's coronary artery status and or actually any other status, like in terms of your vessels in the eyes and in your limbs, all of those things. Looking at endothelial health. And that's very important because the endothelium is micro thick. It's so thin. I can only equate it to something like a thinner clear wrap, that you use that sticks to wherever you put it.
You mean
to.
Saran wrap?
I guess Saran wrap is that. Yeah, Molly's not much in the kitchen, as you can see, but Saran wrap, I guess, is a good way to put it. And this endothelial is very, very important because it lines the entire course of the body: your brain, your liver, your heart, your lungs. It's all about this endothelial health. And here's the thing about this, John. The endothelial dysfunction begins very early. It can start early. You can start to have things like leg cramps. You can start to have things like a little hypertension. You can start inflammatory disorders can start by the endothelial, which, remember, is the inside. We're talking about the inside of the lining now, is really dysregulated. So it's a really important thing to think about, micronutrition.
I'm thinking about this, and you said a few times, tiny, 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 tiny. And I'm thinking, you mentioned the Cleveland Clinic and their test.
Yes.
If you don't get this test, can you miss something like this circulation?
I think you'll find now that lots of cardiologists are using this Cleveland Clinic testing, and it's an extensive blood test. It really is. So it's looking at many things that contribute to the inflammation of the endothelial lining. But what I like to say is that we really have to start looking, when we look at people who've had quote unquote silent heart attacks, when we look at people who said, well, their lipids were under control, everything was under control. Oh, but they had a high blood pressure. Why are they having that? And
you're going to elaborate on that after the break, because we'll get into that. All right.
Sure.
Health Watch is the show, Sundays 8 till 9, our live version here on Talk Radio 1210 WPHT. 855-839-1210 is the number. We've already had a couple of calls, but we always tell you right here at the halfway point that if you call now, you're guaranteed you're going to get in. And many times we get calls at the end of the show, and we're out of time. We can't take your call, so we don't want to do that. We like to accommodate as many as we can. 855-839-1210 is the number here. 855-839-1210. It's Health Watch, Sundays 8 till 9. Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. With Dr. Molly Fantasia, I'm John DeMasi. We both return more of today's Health Watch and perhaps your calls after these words. Welcome back to Health Watch. As always, during the program, operators are standing by at Innovative Medical. 856-489-0505. That's a number I suggest you write down, because you hear it and you say, well, you know what? I'm going to call later on today. Well, then you forget the number. Write it down, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. When you call, if you want more information, they'll be happy to provide that for you. But most importantly, if you want to sit down and get the initial consultation, which is complimentary, with Dr. Molly, that's really where you can get a lot of your information. 856-489-0505. Call that number to set it up. Also, check out the web, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And, of course, our show is Health Watch, and you'll find us here, the live version, every Sunday, 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. Tom is in Pennsburg. Tom, good morning. You're on Health Watch with Dr. Molly.
Thank you.
Hi,
Hope
Tom.
You're having a good day.
Yes, we are. Thank you.
Thank you, Tom.
Yeah, I was wondering if your doctors are affiliated with some of the local hospitals in the area.
Actually, they are. When you say that, you mean like the biggies in Philly? Yes, my medical director is affiliated with two of them. Yes.
Okay, are they restricted on what kind of drugs they can prescribe because of being with a hospital?
I'm not quite sure I understand the question.
No,
Are you talking about?
Does the hospital restrict your docs from prescribing certain medicines because of his affiliation with the hospital?
I would say to you that I've never heard my medical director say any of that. He's a pretty independent thinker, and I think that he has a private practice, private primary care practice, and I don't think I've ever heard him say that he was restricted. Are you thinking about any particular drugs? I'm interested in the category.
I've heard words about ivermectin for COVID.
I knew you were
and
getting
the
to
hospitals.
that. Okay. Yes. Thank you, Tom, for being honest. I thought you were getting to the ivermectin, and that's what I wanted to hear. I would tell you that no surprise at all. I would tell you that it's not just the physicians who are restricted. In some states, the pharmacist is restricted from putting them out. As a matter of fact, New Jersey's one of those states. So it is difficult to get ivermectin, I would tell you that, and because the data isn't out there that claim there's no data to support its use. But again, I think you have to go to the physician who actually has a more open mind and who will look at some of the alternative data and help a patient. I mean, there's also been some restrictions about the fluoroquinoline component as well.
Right.
So, yeah. So, listen, Tom, I would love to have this discussion with you off the air. Okay? Is that pretty clear? Thanks, Tom.
Tom, thank you for the call. We appreciate it.
God bless you, my friend. Now, I want to say something about that. I knew you were trying to explain that. I was already ahead of you, thinking exactly what he was asking about. And it wasn't that I didn't understand the question. I did, but I knew the underlying question was.
You kind of knew where it was going.
And here's the thing, John. I'm actually glad they brought it up. Really, this is an unbelievable period of time in my lifetime where physicians are under scrutiny for medical judgment. This is why they used to call things medical opinion. All of a sudden, all of that went out the window with this particular thing. The same thing, I'm not an anti-vaxxer. I would tell you that my physicians are not anti-vaxxers. But at the same time, they respect the right of the patient. And I think, all of a sudden, these legislative bodies, these administrative law kinds of situations, which most physicians and hospitals work under, has now come into between the patient and the physician. And I think, from a personal point of view as a patient, I think that we could get into a heck of a political discussion about it. But where I stand. I believe nothing should get in between the physician and his or her patient.
All right, 855-839. Right, well said. 855-839-1210 is our number here if you have a question for Dr. Molly or you want to talk about a medical challenge or whatever you want to talk about. So before the break, you were asking the question, and I think this is interesting. People who have, perfect cholesterol and they have a perfect situation, and then they have a heart attack.
Right.
So why is that?
Well, I want to talk about microcirculation, okay? And microcirculation has to do with the endothelial circulation. One of the things I want to say about, have you ever thought, because this is a question that comes up in my mind a lot, why, for example, that we talk about a blockage, that there's a blockage in only a certain area of the particular artery, right?
Yes.
Have you noticed the rest of the artery's open? So you have a 50% blockage in one particular area. Why do you think? Do you think the cholesterol just goes there and hangs out? Or do you think that maybe, just maybe, it had to do with the endothelial lining being inflamed? And that particular area wasn't getting enough of your nutrients and those kinds of things that could contribute to this. And maybe that's the problem. Think about what I'm saying. It's pretty complex.
Yeah,
it actually is pretty easy.
All right, we'll get back to that. We'll go into the phones.
Okay.
Joe is in Mount Airy. Joe, good morning. You're on Health Watch with Dr. Molly.
Hey, Joe.
Good morning, Johnny. Good morning, Dr. Molly. Happy New Year to both of y'all. And
Happy
your
New
staff.
Year
Same
to
to
you,
you,
sir.
Joe.
God bless you.
God bless you as well. I just want to say this, Dr. Molly and John. I'm definitely, I told y'all before, I love y'all show. I listen to it every week, and I'm definitely going to get over to Martin soon for the hydration at some point. God's will. I'm going to get over there sometime before the 2022 is over with. But I just want to say this real quick. Thank you, Dr. Molly. You know, on your last caller, I'm just going to be honest with y'all. My doctor, I love her dearly. She's very open-minded. I'm not getting the vaccine. I don't tell nobody what to do with their body, but me personally, I don't believe in the vaccine. I don't trust it. I'm not getting it. And my doctor put me on ivermectin. And I can honestly say to you and John, Dr. Molly, I must be doing something right because I got tested twice, and each time my test came back negative. I'm taking the ivermectin, I'm taking zinc, I'm taking elderberry, I'm doing everything to keep my immune system built up. And I know friends of mine that have got both the double shots, the boosters, and they still can't, and they wear masks. They've been isolated, and they still came down with COVID. So I must be doing something right. I must be, you know.
Hey, Joe, you're my kind of patient. Joe, listen, I applaud your doctor. I applaud you. But you know what the situation is, right? You're smart.
Oh, yes.
You know what the situation is. And I noticed you also said something beautiful. Elderberry, zinc. So you're taking everything that we know contributes to your immune system. So I got to applaud you, Joe. How old are you, my friend?
I'm 60 years old, Dr. Molly.
You're a baby.
He is a baby.
And you're a smart man. So I'm going to tell you, I applaud your doctor. I love her. I would like to meet her. And I will tell
you, Dr. Molly.
I appreciate that. And I'd like to meet you, too, because you're a smart man. Keep up the good work. And
I
again,
will, Dr. Molly. You and John keep doing good work with what y'all doing over there. Y'all doing
All
a
right,
big
Joe.
job. Like I said, I always
Thank you.
It's a place for alternative medicine in this society. Well, everything has to be over the counter and pharmaceutical. And I appreciate what y'all doing. Love y'all, Dr. Molly.
Okay, Joe. Thank you for the call. Appreciate it.
Thank you.
All right, I have a question. All right, because we got on this ivermectin thing.
I know.
Is this something people can get, or does it take a progressive doctor who thinks outside the box?
I would say look. People can get it, and people were ordering it. This is part of the problem. People were ordering the ivermectin from these websites, and maybe they were getting ivermectin, or maybe they were getting veterinary-grade ivermectin, and maybe they weren't getting an appropriate dose, and maybe all kinds of things. But the point is, if you have a progressive physician, I believe they will sit down, and if they're allowed to do it by state regulation, and the hospitals are a whole other story. If you want to keep your privileges, that's what they call them, your privileges to send your patient there to go to their specialist, that's a whole different ball game. You gotta play the game. So here's the thing, John. Ivermectin's been used for years in other countries. It is an antiparasitic. It was used for malaria, so it actually had an indication. It had an actual bona fide indication. This is what they would consider an off-label use. We use off-label drugs all the time in this country as well. This just happens to be a big political football right now.
Okay.
So,
well, you explained that. I was curious.
Cool? Yeah,
right,
no,
absolutely.
it's available.
Okay. All right, we're coming up on our final break of the morning, which means you still have time to jump in with a question here. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. And again, if you have a question for Dr. Molly, now's a good time for you to call in, 855-839-1210, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We return. More Health Watch after these words. Back here on Health Watch, again, operators are standing by at Innovative Medical, and they will be there well after we leave you at 9 o'clock. So, listen, they're not even taking a break for the Eagles game, okay? So, feel free to call anytime, 856-489-0505, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And a quick reminder, if you miss any of today's show, or if you hear it and you want to hear it again, we have our Health Watch replay, which we sometimes call the Sleeper Special. Because it's on at 4 o'clock this afternoon, 4 to 5 every Sunday. It's our Health Watch replay here on Talk Radio 1210 WPHT. But this is the live version of Health Watch, and we're going to go right to the phones. Adriana is in Haddonfield, New Jersey. Adriana, good morning. You're on Health Watch with Dr. Molly.
Good morning, Dr. Molly. We love you, and we are a frequent flyer with you.
Oh, yes, I do know. Now I know which Adriana this is. How's everybody doing over there? Good, I hope?
Everyone's great. Good. So this week I was going around, and I'm just kind of like doing my thing, researching. You know me, I'm always kind of looking for something out there to take and drink. And so I've been hearing a lot of stuff. When you want, for alternative medicine's sake, when you want to look for the cleanest information, for the cleanest studies, where do you go to look? Because a lot of people are saying that it's a little difficult in the U.S. right now. Do you look at UK? Do you look at Sweden? Where do you like to get your information from when you're traveling?
That's great.
Down this road?
This is a great question. Okay, I try to read as much of the European literature that's out there, including the one from the Lancet out of England. But I also look at a lot of, believe it or not, Adriana, I look at a lot of the data that comes out of Rome and also Milan, the medical centers there, as well as the German data. So it really depends on what particular thing I'm interested in. In particular, I can tell you that this viral thing, which is bothering all of us, I've actually looked at some of the data that came in through Australia. And so it's amazing. And you and I both know we have to watch where we get our alternative data from. And I use PubMed too. And so I'm on ResearchGate, if that's something you're familiar with. I actually published an article on that, ResearchGate. And again, I did that with several of my Italian colleagues. In particular, I was looking at mast cell production on that, which by the way, mast cells have something to do with what's going on with this COVID right now, because it turns on those particular cells, which releases histamine and things like that. But nonetheless, I would look at some of that. And again, look at the studies, including the qualitative studies that come out of the European literature. Okay? What's going on? Thank you, Andriana, for that.
Welcome.
Thank you. Thanks a lot for the call.
All right, Adriana, thank you. Appreciate the call.
So funny. She's a patient.
You're also aren't you a part of a group of alternative medicine
several
professionals? I mean,
several.
You're in groups, and I see on your office wall you have some plaques hanging up that you're part of these organizations.
I'm actually a guest lecturer right now at Pacific College. A good friend of mine, Dr. Tamara Carr, is on the faculty there. And I'm going to be talking a little bit next week. I think maybe it's the week after. Barbara has the calendar. You know that. Yeah. Barbara and Joanne keep me straight. But I think I'm going to be talking about the influence of hydration nutraceuticals and its influence on the COVID and what's going on. And I think, so I do a lot of research, and I call other colleagues, and I find out what they're doing clear across the country. So definitely. Do I think the West Coast's a little bit more open-minded? I would say yes in many areas. That's true.
All right, let's finish where we live, because you were talking about
people aren't interested in this today, right. So no worries. But
you were asking the question: how come the blockage is in a certain spot and it's not in the rest of it? So
right, and for years and years and years, what they thought, they called that skip lesions, meaning they skipped around and formed randomly. But I started thinking about this, and I said, well, wouldn't you think that if blockage was caused by particular substances, it might go through the whole length of the vessel? Well, now you're getting into what I believe is the true challenge. This microcirculatory system that is protected, your whole body from head to toe has this endothelial lining. And my belief is that when that gets dysregulated and you get inflammation in there on a micro level, now mind you, small, tiny, you start to have all of these problems like hypertension, like some dementia, maybe inflammatory disorders. And I'm starting to think that the endothelial lining has a lot to do with cancer disorders. So, and mini strokes, John, what are they? Oh, only a tiny thing, right? Small vessels. So I think it's really important to look at hydration therapy as one of the therapies that can keep that inflammation at bay, because we can use the anti-inflammatories, we can use things like the arginine that is needed for the nitric oxide development in the body. And I think those kinds of things are very important. For example, I'm beginning more and more to believe they talk about all the ED remedies out there. Just a side note, ED remedies, scar tissue, that kind of thing. Okay, I can live with that. But I often say it's the global circulation that counts, because it's in the microvessels that you really need to keep inflammation down so that you can sustain the erection. So these are the issues that I see every day, and I think we've sort of put microcirculation to the back burner, but it's very, very important, and I think it's something that we address all the time in our chelation therapy.
So with these micro vessels, and you've used the word micro often today.
Yeah.
How do you get to that? How do you know?
You can only get to that with molecular exchanges because they're so tiny.
Okay.
And they've got to work on the endothelial transparent lining, the saran wrap that's really going all around the vessels. And I'm telling you, this is very, very important. This is one of the reasons why you'll hear Barbara talk about nattokinase many, many times, because that's one of the substances, one of the natural substances that can keep the blood flowing on a micro level. Okay, so there's so much to this. It's very involved, but I'm trying to keep it simple, stupid. Take chelation, it will help.
Okay. Well, that's the bottom line. Call Dr. Molly's office and get the free consult, and then many of your problems potentially could be solved. Okay.
Well, certainly feel better. You have a great quality of life.
That's a good way to wrap up the show.
Thanks, John.
And that is going to put the wraps on another edition of Health Watch. Don't forget, operator standing by right now at Innovative Medical, 856-489-0505. 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Don't forget, if you missed any of today's show, we have our Health Watch replay this afternoon, 4 until 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses, Lana and Jess, and our medical assistant, Karen Kathy. I'm your host, John DeMasi. Thank you for listening, and have yourself a healthy week. We'll do it all over again next Sunday. Health Watch live, 8 till 9, here on Talk Radio 1210 WPHT. You take care.